You can start.
Good afternoon, everyone. Myself, Dr. Kanchan Durkar. I am consultant at Oasis Fertility Pune. We are here with you with our another Facebook Live session. And today we have with us Dr. Nilesh Balkawade, sir, who is a clinical head and fertility specialist at Oasis Fertility Vakad and Kharadi branch. So we welcome you, sir, for the today's Facebook Live session. And our
Thank you.
today's topic is blastocyst culture. So our today's topic is blastocyst, that is a day 5 embryo culture, and we have some frequently asked questions about blastocyst culture. So we welcome you, sir, for the today's session.
Thank you, Dr. Kanchan. We can go ahead with the questions.
Yes. So my first and foremost question is, what is blastocyst? What is the blastocyst, and how it is different from the day 3 embryo or cleavage stage embryo?
Okay. So basically, embryo is formed by the process of fertilization. Normally, this fertilization takes place in the fallopian tube. But when this fertilization is occurring outside the body, we call this as in vitro fertilization or IVF. So IVF can be done by the routine conventional IVF, or we can do a ICSI or intracytoplasmic sperm injection. So once one good egg and one sperm unites, the embryo is formed, and this embryo then goes into number of stages and cell divisions. So initially, the male and the female pronuclei are they get united, and there is a crossover of the genes, and therefore an embryo starts to form. After 12 hours after the embryo formation, we check for fertilization, and after that we get to see whether the embryo is dividing or not. So first the embryo divides into a 2 cell stage, then a 4 cell stage, then a 8 cell stage, then a 16 cell stage called as morula. So this sequential cell division is very important for us to see whether the embryo is properly dividing. So these cells of the embryo are called as blastomeres. So if we see a day 3 embryo, the day 3 embryo is composed of 8 to 10 such blastomeres, and this is called as a cleavage stage embryo. But at this stage, we can just grade the embryo as grade 1, 2, or 3. But we are not able to tell which is the best embryo out of this. Even once we transfer this day 3 embryos, we are not sure which embryo which will implant. Therefore, we have to choose more number of embryos for embryo transfer. So blastocyst is conversion of this day 3 embryo to a day 4 and subsequently a day 5 embryo. On day 5, all these cells, that is the blastomeres, they have already gone into a compaction stage a day prior, and a cavity starts to appear in this embryo. This cavity is called as blastocele, and the fluid in that is called as the blastocyst fluid. And some cells of this embryo are go to the periphery of the embryo. This is called as the outer cells or the trophoectodome, and some cells form a clump inside the embryo, which is called as the inner cell mass. This inner cell mass later on goes on to form the embryo or the baby proper. So this is what is called as the blastocyst. We'll go on to answer the next questions. Of course, I'm not going to answer it all in one line. So this is about blastocyst.
Okay, sir. So. So my next question is, sir, ki how what are the cells that is the blastocyst is composed of? It is more of the medical question, but what the patient needs to know about the blastocyst, that how it is graded, or what are the cells on which it is graded, like that,
Yeah.
which the normal patients also needs to know. Like,
Yeah. So the blastocyst is a circular or a spherical structure. The outer layer, that is the peripheral layer, is called as the trophoectoderm, and some cells are compressed in the inner part. This is called as the inner cell mass. Now, when we see the blastocyst embryo, we do a visual or a morphological grading of this embryo. So many of the patients have a query, what is the grade of my embryo? So this grading will be based upon what we see, that is the morphology or the size, shape, and texture of the embryo is what is important in morphological grading. So the inner cell mass forms the first part of this morphological grading, and the inner cell mass should be equally distributed. It should have a more number of cells, and there should be no fragmentation in this part. Then we can grade this as grade A. Once some abnormal features come into picture, it will be classified as grade B or grade C. The Then there is the proper expansion of this embryo. So if the embryo is slightly expanded, it will be grade 2. If it is properly expanded, it will go on to become 3 and 4 and 5 and 6. The sixth grade embryo is the maximum expanded embryo, after which probably it will hatch. So now what is hatching of embryo? It will come out from the zona layer outside. So this is called as hatching of the embryo. So uh, this is what is important about the different cells of the blastocyst and how we can grade this. Now, what is the importance of each of these cells is that the inner cell mass goes on to form the baby, and therefore that part is very very important. But the trophoectoderm is also very important when it comes to grading, because this is the part which is going to go and attach to the decidua or the endometrium of the mother, and this is going to invade the decidua. So the trophoectoderm also has to be proper for implantation to occur. Now, another important clinical correlation of these two is whenever we are doing biopsy of embryo or pre-implantation genetic testing. So, in a pre-implantation genetic testing of a blastocyst, we tend to take biopsy from the outer layer, that is a trophoectoderm, and therefore there is no damage to the inner cell mass or the baby proper. So it is technically easy to perform a trophoectoderm biopsy or a biopsy of the embryo on day 5. So this is one another advantage of taking the embryo to day 5 rather than doing a day 3 biopsy, where we have to take a complete cell of blastomere for checking. And this has a higher risk of mosaicism also. Okay. So this is about the importance of cells of a blastocyst.
Okay, sir. So, and now the question is, why we take the embryo to day 5, or why this blastocyst culture has come up, and why it has gained so popularity, that day 5 culture, blastocyst culture. Why this has come up? What is the importance of blastocyst culture?
Yeah. Very nice question, because there are very few labs who are equipped to do this blastocyst culture. You know, the media should be good, the culture conditions should be good. Okay, the lab quality assurance, quality control, that is the QA/QC of the lab should be good. Then only you can do this blastocyst culture. Not every IVF lab is capable of doing this blastocyst culture, because of all these strict conditions which we need to maintain when we are doing a blastocyst culture, right? So the media, the pH of the conditions, the temperature, all this has to be controlled quite strictly. Then only we can get a very good blastocyst. So uh, the importance is that whenever we are doing this conversion, there is a risk of contamination, there is a risk of the embryo growth being halted from day 3 to day 5, and therefore we should be quite sure of our lab whether we can take this embryo from day 3 to day 5. We need to maintain the air quality appropriate, very appropriate, by checking the VOC levels. We need to maintain the culture conditions properly by maintaining around the clock air handling unit, that is the AHU facilities, also along with the tri-gas facilities. So we need a tri-gas to maintain this proper growth of the embryo. So it cannot grow in any condition. So this has to be proper. Then we need to be handling the embryos to the minimum possible time. So we should be able to give uninterrupted culture to embryos. So this is possible only when you have a good culture conditions. This is possible when you there is less need of removing the embryo and to see it. So we can have embryoscopes which can take the embryos till day 5, and we will not be, it is not required to take the embryos outside and see those. So all this helps us whenever at Oasis to go for blastocyst culture. And what is the use of this? It will give us a very good embryo. Even a single embryo transfer can help. So in blastocyst culture, the major risk of multiple pregnancies can be nullified. We can just do a single embryo transfer.
Okay.
Secondly, this embryo has got a more capability of attaching, more success rate, as has been shown in numerous studies. The live birth rate, the clinical pregnancy rate increases whenever we are doing a blastocyst transfer. Also, when it comes to comparison of a day 3 and a day 5 embryo, it has been shown that the trophoectoderm biopsy or PGTA is more easier in the day 5 embryo. So all these factors favor the use of blastocyst culture over a cleavage stage or a day 3 transfer.
Okay. So my next question was that only ki why day 5 embryo transfer should be preferable, and why whether the success rate of day 5 embryo is more than the day 3 embryo.
Yes, of course, the success rate of a day 5 embryo is more than the day 3 embryo. It has been shown in numerous studies that if we go for a blastocyst culture, if we, along with that, if necessary, we freeze the blast and then do a frozen embryo transfer with the blastocyst embryo, this is going to give you a very high success rate, and this has phenomenally improved the success rates than the previous success rates, and with a decreased risk of multiple pregnancy, which I think is very, very important in this today's world, where the risk of preterm deliveries is increasing because of more number of IVF pregnancies. We don't want a twin pregnancy. We don't want a triplet pregnancy nowadays. We want a single embryo with a single baby. Sometimes even a two blast transfer can be done where the risk of twins is there, but yeah, if that is acceptable, that can be taken. But initially, the number of embryo transfers were much more, like three day three embryos or 4 day three embryos. Even some used to put 5 day three embryos. So this increased the risk to the mother in the cases of multiple pregnancy. They may have to go for a fetal reduction and so on. So that risk has gone down, and also the risk of preterm birth has gone down with the use of more and more use of blastocyst culture. So all this has helped to us, and even the success rates have gone up.
Yes. So next question is that only that how many embryos is not patient to patient it will vary, but ideally how many embryos or how many blasts we do transfer or we should transfer to get the maximum success rate.
Yeah, if the grading of blastocyst is very good, if the blastocyst is already tested for pre-implantation genetic testing for some or the other reason, in many of these situations, single embryo transfer is the norm today. We have to do single embryo transfer for such patients. If the patient has got any medical illnesses, if the patient has got any history, obstetric history, which is contraindicating multiple pregnancy, all these conditions we should go for a single embryo transfer. Only in cases where the grading of blastocyst is not that good, if the patient wants a two embryo transfer, and there are situations where we might think that a two embryo transfer might increase the success rate, only in these cases we can go for a two blast transfer. I think it is a single embryo transfer is the norm of the day, and if not single, maybe maximum two blastocyst embryo is what we can do. Anything more than two we are not practicing as an international standard or norm.
Okay, sir. So my last question will be like, what are the complications? Not complications, but what are the risks while we go for the blast culture or we go for blastocyst formation, blastocyst culture? So what are the risks and what are the benefits? Benefits actually we have discussed, but what are the risks while we go for the blastocyst culture?
Yeah, so basically, the risk is that when the number of eggs which we retrieve for IVF is less, then the conversion and the quality is also poor, then the conversion to the blastocyst would be very less. So we may be able to form day 3 embryo, but the conversion from day 3 to day 5 is less, and the number of blastocysts, sometimes it may happen that we are left with no embryos or no blastocysts are formed, and the embryo arrests in between. This can pose a risk while going for blastocyst transfer. Secondly, other parameters, like if the lab is not well equipped, if the media is not a single step media, or if there is some problem with the media, all this can cause a poor conversion to a blastocyst. So we should be very sure whenever we are going for a blastocyst transfer, especially at Oasis, we follow this, that when the number of eggs is less, we tend to counsel the patient about the outcomes with blastocyst transfer whenever, before we go for a blastocyst conversion. So this is very, very important. But once we are through and once we go and enter the blastocyst stage, then probably the results are much, much better.
Yes. So, yes, sir. So I think that the question from my side. If any topic that has been left, you want to add something.
Yeah. So this blastocyst culture, I think it comes with no additional cost at Oasis Fertility. We don't have any additional cost whatsoever for blastocyst culture. We are routinely going for blastocyst culture, which is improving your success rates of IVF and ICSI, and it is offered to majority of the patients. Only in those patients where we see that the egg quality is very, very poor, or the number of eggs are very, very less, then probably these are the patients in whom we may not go for a blastocyst culture. Otherwise, majority of the patients we are going for a blastocyst culture. We are going for a frozen embryos and then transferring these frozen embryos or blastocysts for in the subsequent cycles, which has which has led to a very great improvement in our success rates when it comes to not only clinical pregnancy but also live birth rates.
Sir, want to add, sir, do you want to add regarding the assisted hatching, with the laser assisted hatching that we do for the patients? Does it help in the improving the success rate or implantation rates of these patients?
Yeah. So once we are doing a freezing of embryos, it is always better to go for assisted hatching, because it has been shown that zona hardening, or the outer layer of the embryo, it becomes little bit harder when the embryos are frozen. Secondly, whenever the eggs are problematic, like the patient is older, the patient has a history of PCOS, or it has a history of tuberculosis, or some other factors, this zona can be little bit harder or thicker, and these are the patients in whom you may require assisted hatching. And assisted hatching, one of the techniques, very easy techniques, is laser assisted hatching, which again improves the success rate, because if the embryo doesn't hatch out, then it is the implantation or the attachment of the embryo becomes a little bit difficult. So therefore, blastocyst culture along with assisted hatching with laser has definitely improved the success rates.
Okay, sir. So, I will wind up this Facebook Live
There is
session.
one question in the comments box.
Thank you. You can read, sir. Yes.
I get embryo grade 2 to 3 blastocyst embryos and I have PCOD. Please suggest success rates of my IVF cycle. So now you have got 2 to 3 blastocyst embryos, but here the grading is not mentioned. So that is good that you have 2 to 3 blastocyst embryos. You can go ahead with transferring these embryos. Of course, since the embryo quality is not mentioned, we cannot comment about success rate. But yes, you have a fair chance of success. Success rate not only depends upon the number of blastocysts, it also depends upon the quality or the grading of blastocysts, and also it also depends upon the embryo endometrium thickness and the endometrium quality, the pattern of endometrium and the endometrial blood flow. It will also thirdly depend upon the environment in which the embryo is going to go, whether the patient has any adenomyosis, endometriosis, or other problems, that is going to affect also the success rate. So all these parameters have to taken into consideration before we comment upon the success rates of IVF. The patient has
Yes.
mentioned that it is grade 2 embryo, so you have fair chances of success. We wish you all the best.
Okay, sir. So, so I think we
Yeah.
should end this session. Yeah.
Yes.
So we thank Dr. Nilesh Balkawade sir for the today's Facebook live session, and we thank all our viewers for attending this Facebook live session. And if at all any queries you have, uh, you can contact at the helpline number that is flashing on your screen, or you can have a physical consultation at our center that is at Oasis Fertility Vakad or at the Kharadi branch. And we thank all our viewers. Thank you, sir. And thank you very
Thank
much. Thank you,
thank
everyone.
you.
Yeah, thank you.